Welcome back to my channel. Don't forget to like and subscribe. Diabetes care doesn't usually fail all at once. More often, it gets delayed, quietly, gradually, and with good intentions. If you or someone you care for has been told to wait and see, despite rising blood sugar numbers, this video is for you. Delayed diabetes care is incredibly common, especially in older adults, people living alone, and those who don't feel unwell yet. Today, we're going to talk calmly and clearly about what the guidelines actually recommend, and why timing matters. Delay doesn't usually mean no care at all. It often looks like reassurance without structure. Blood sugars creeping up, HbA1c slowly rising, symptoms brushed aside because they're subtle, and over time, those small delays add up. There are understandable reasons why care gets delayed. Early diabetes and pre-diabetes can feel invisible. People may still be functioning well. Clinicians may want to avoid overtreatment. Families may not want to worry loved ones. But diabetes is progressive, and timing matters. Clinical guidelines are not designed to scare people. Across major diabetes guidelines, including WHO, NICE, and international diabetes bodies, there is a clear emphasis on early action. Not extreme action, but structured action. This includes lifestyle support, monitoring trends over time, and adjusting care when targets are consistently missed. One abnormal reading doesn't define a person. But repeated elevated values over months or years signal increased risk, even if someone feels well. That's why guidelines focus on patterns, not single numbers. Delays disproportionately affect people who don't have someone pushing on their behalf. Older adults, people living alone, and those whose symptoms are minimized because they don't look sick. When action is delayed too long, people often enter care at a much later stage, sometimes through emergency admissions. The irony is that earlier, gentler interventions could have reduced this burden significantly. Early diabetes care doesn't mean panic or aggressive treatment. It means structure, clear follow-up, support around movement, nutrition, and monitoring. Small steps, taken early, are often enough. If this story feels familiar to you, you're not overreacting. Wanting timely care is not anxiety, it's prevention. Diabetes care isn't about fear. It's about timing. I've written a companion blog post that explains this further, with evidence and practical context. You'll find the link in the description. And if this resonates, you're not alone.